Good afternoon. I'm George Latimer, Westchester County Executive. I'm here with Ken Jenkins, Deputy County Executive. It's Monday, February 22nd, and this is the first of our twice-weekly Westchester coronavirus update. For those that are following us, we are just about now with this last week completing a full year under this pandemic, and we're going to deal with a couple of stats that we have, a few other bit of information about vaccines. In theory, a fairly short report today since we spent a lot of time on Friday getting into a couple of things in some detail. Any of our past reports can be seen on this Facebook page, and you're happy to look back over that period of time. The numbers that we have for today track to the state tracker, which was last updated yesterday. As of today at 2 o'clock, we're awaiting the Monday update, and so the numbers will change within the hour most likely. But as of this moment, we're looking at Sunday's results for February 21st, and that showed that we have 6,492 active cases of coronavirus in Westchester County. Now, keep in mind, when we track cases, it's on the basis of people who have tested positive for coronavirus over a period of time, and we subtract out those that have gone through the 2-week incubation period from those that are the total to date. Not everybody who has contracted coronavirus was tested as having been positive, so many people will indicate that there are many more people that have gotten coronavirus at some point in time. There was no way for any of us to know that if they didn't test at a certain period of time. Perhaps the presence of antibodies in their bloodstream might point to the fact that they had COVID previously and fought it off. But for our purposes, we have to go with those number of cases that have been tested. As of yesterday, 2,001,761 COVID tests were held in Westchester County. That's 2 per person in Westchester County to this point, and that number continues to rise as we test rather aggressively every day, usually in the vicinity of 10 to 12,000 people. On a strong day, 15,000 people get tested. A lighter day might be about 7,000 or 8,000 tested. But almost literally 1 year to date, 2,001,761 tests for coronavirus, a total of 104,400 individuals at some point in time over the last year tested positive for COVID. And of that number, 97,908 had tested positive prior to 2 weeks ago. So the number of active cases is 6,492 as of yesterday here in Westchester County. That continues now what amounts to about a month-long diminution in the numbers of active cases. The diminution started once we slightly past 2 weeks after New Year's Day or New Year's Eve, and then New Year's Eve Day. And that was the peak period of time of active cases, and then now that number started to come down. To give it to you in reverse, if the current number is 6,492, the prior week the number was 7,297. That's a drop of 800 approximately cases in a week. The 7,297 number the week before that was 8,683. That traces back 2 weeks ago. If you go back 3 weeks ago to the last Sunday in January, the number was 10,506. And almost a full month ago, on Sunday, January 24th, we had 11,494 cases of COVID, active cases. So we've gone from 11,494 down to 6,492. That's a drop of 5,000 active cases over the last month. That is good news. That is a diminution in the amount of infection. And when you look at the particular infection rate, just yesterday, we had 410 positive tests out of 9,754 tests. That means an infection rate for the day of 4.2%. So on some days we've dipped below that into the 3% range. A couple of times we've been above that in the upper 4% range. But in the last number of weeks, a 4.2% infection rate is below what we would consider a dangerous number. If we were high single digits, that would be a high infection rate approaching 10%. And in certain places at certain times, we've seen 20% infection ratio, meaning 20% of all the people tested come back positive. Here, as of yesterday, it was 4.2 for the day. And in the aggregate, we're still looking, and we're in the aggregate, we're taking in the peak of last year and then the more recent peak. We are looking at a diminution in the amount of active cases, meaning we have less people infected that are tested this week than 2 weeks ago. And that is a good sign. That's a sign of a trend. And now, after 4 or 5 weeks, we feel pretty comfortable that we can say that we're in a trend that is going downward, which is good. The next metric that we look at after that is number of hospitalizations. The most recent trackable hospitalization number I have is 403 individuals. The week before that, that was 481 individuals. So that's a drop of 78. The week before that was 507. So we've dropped 100 in net hospitalizations in 2 weeks period of time. And the week before that was 571 individuals hospitalized. So we've dropped 170 individuals in the course of 3 weeks who are hospitalized. The less people that are hospitalized, the less severe the disease is. And for those who are taking vaccines, one of the advantages of the vaccine, aside from you won't get the disease, if you do get the disease, if you're in that very small cohort that still gets the disease, you will have it much less aggressive version of it and much less likely you'd be hospitalized. So we would hope that as more people get vaccines, the active case number would drop more dramatically and the hospitalizations would drop dramatically. From the standpoint of fatalities, and we track fatalities by how many passed away in a week to get a comparable situation. Pandemic to date, 2,054 people have died from COVID virus. That is a significant number of Westchester residents. Over the course of the last week, we lost a total of 33 individuals. That number is down somewhat from the prior week, where we lost 50 people from COVID. And then the week prior to that, we lost 77 individuals. So 77 to 50, now to 33 in 3 consecutive weeks. That is a diminution in the number of deaths. I hasten to add every single time, every death is a tragedy. Every person mattered to somebody. And we never want to turn a person into a statistic. But we look at statistics to tell us what's happening. You have a downward trend in active cases, a downward trend in the number of hospitalizations. You have a downward trend in the percentage of infections, and you have a downward trend in the amount of fatalities over the week. That is all a good sign. We are now officially 2 weeks after the Super Bowl, and we were looking to see what kind of infection impact we might have had from Super Bowl parties. So we will watch over the next few days whether or not we see an uptick in those numbers, which might reflect people who were potentially involved at a Super Bowl party without proper protection, who might get the disease. That might not happen, and we would be very happy if it doesn't happen and it turns out to be a non-event. So we're going to watch that over the next few days. When we give you a Thursday update, which we're planning to do Thursday at 2 o'clock, we'll see if our numbers for Monday, Tuesday, or Wednesday start to tick up, and we'll wait a full week until we know we've cleared the Super Bowl party impact, hopefully positively in all of that. The other set of metrics that we're watching are the number of people that are being vaccinated. Now, in Westchester County, there's an allocation of vaccines that go to 4 different pockets. There is the State County Center run facility, which the county assists in. That is the single largest place where vaccinations occur. The county, as an individual entity, running now 2 clinic spots, one at the Westchester Community College, one in our downtown White Plains Health Clinic, has received the second largest amount of vaccines to distribute. And then the state distributes to a wide variety of pharmacies, some chain pharmacies, some local independent pharmacies. And then finally, the state organizes some pop-up locations where they partner with a healthcare partner and a municipal not-for-profit partner, and they provide a certain number of doses for a particular purpose in a particular location. Over the weekend on Saturday, there was a pop-up location in Portchester at the Portchester Senior Center. That was a partnership between the Portchester Seniors Program and the Open Door facility in Portchester. And we've referenced that a couple of weeks ago. We had similar ones in Mount Vernon, Yonkers, and in Peekskill, and we expect more of them to come. These decisions are made by the state. They determine where the pop-up centers will be. But the allocation of doses that go out fall into one of those 4 buckets. And for our purposes as a county government, the one that we track directly are the doses that we get as a county government to use for first and second doses at both the community college and at the health clinic. And we have word that in week 11, which is what we're entering into in terms of the vaccine distribution, that Westchester County as an entity, the governmental entity, will receive 2,500 doses of vaccine, 2,500 doses of vaccines to distribute. And those will be going for both first and second shots. We'll talk about that in a little bit of detail in a second. But when you look at the aggregate number of people who've received a vaccination, total vaccinations, this is first and second shots, so we may be double counting some individuals because they've gotten 2 shots, but the total number of vaccinations at the Westchester County Center, state-run, county partner, 60,731 vaccinations given out at that facility, and they're averaging well over 1,000 a day. Between the two county locations, 9,707. We are the second largest of the two major places where vaccines have been distributed. So between the county center and the county's two locations, 70,438 vaccinations have occurred. And those numbers are rising. At some point in time, not too far from now, we will have vaccinated as many people as we have had people that officially were tracked as having COVID. The numbers don't correlate, except they're an indicator of how much we're rising in the vaccination challenge. But when we get an allocation of 2,500 a week, and we're tasked with making sure that all the teachers in the county are vaccinated and other occupational cohorts, as part of the way the state has laid out these vaccinations, we have to repeat what we've said before. There is not yet enough doses of vaccine sufficient to meet the demand of the people who are eligible as of today. And eligibility falls into a couple of different categories. We'll mention them again: 65 and older. Everybody in that age cohort is eligible. There's a series of underlying illness issues, and anybody of any age that suffers from one of those illnesses is eligible for vaccination. And then there's a series of various occupations. We've mentioned already: first responders, police, fire, EMS, teachers, funeral directors, taxi and limousine drivers, restaurant workers, people who fall into that cohort who are eligible as well for a vaccine. But if you're under the age of 65 and you're healthy, the door has not yet opened up for your vaccination. Some people have gone to other states where they have different policies, but here in New York State, 65 or older, comorbidities, or particular occupation is what triggers the availability of getting the vaccines. And to have reached 70,000 for the total number of vaccines is a good sign. We are by no means done. Ken Jenkins is going to talk in a couple minutes about the second big site that's being planned by the state and the federal government. We're very excited. We're happy to have 5 big sites if we could get to that point, but we're happy to have a second site. Certainly the county center has worked out very well. However, as you're well aware, we've had some winter storms, and the winter storms have caused us to have 2 separate types of problems. The one problem that you see is on specific days we've had to cancel either at a county clinic or early in the month of February at the county center, we've had to cancel the distribution of vaccinations. And once a group of people are canceled that have appointments, those people have to be rescheduled. And now that we're getting into second dose situations, the second dose has a specific amount of time, whether it's the Moderna or the Pfizer type of vaccine, in which it must be administered in order to have maximum effectiveness. And so we have no option to delay a second dose that we've had to cancel because of weather. That's one side of the weather problem. The other side of the weather problem is that the production areas within the various pharmaceutical companies were unable to get vaccine to us and to other places where vaccines were distributed, and so there were cancellations because the vaccine doses never came into Westchester in the first place. We had, as you well know, you're tracking it on TV, you've heard a lot about Texas, but that freezing weather is all across parts of the South and the Midwest and has affected shipments of vaccine to Westchester and to other places. So by our calculation, the number of people that had to be postponed for shots for second doses that started last Wednesday and through today because we did not have the shipment of vaccine in is about 1,900 people. Had those people been able to get their vaccines, that 9,700 number that I said before would be 1,900 more, so we'd be up 11,000 or so people. It's very important that those folks who deserve the second dose get them in a timely manner. And so once we receive the vaccine shipment, which we're expecting today, tomorrow, everyone that gets a second dose will have his or her appointment rescheduled, and that becomes our immediate priority. If you haven't had the first dose, you can take the first dose whenever it's available to you, and then the clock starts ticking. But for those people that have already had their first dose, the clock is ticking, and we can't afford to delay. And what will happen is we will have a combination of people getting first doses and second doses over the top of our existing schedules. So there may be lines that would be formed. And as I've said in the past, we've managed to do a very good job both helping at the county center and in our own 2 locations of being able to manage the demand. People stay on appointment, the lines are minimal. But when people find that we now have to throw some rescheduled people in, it creates a bottleneck, and that bottleneck may lead to lines. You should be aware of it. You should understand that it will take some additional time. And if you have an individual with you who may not be able to, stand on the line, then you need to call ahead so we can have alternate arrangements made, and we'll certainly help an individual in a wheelchair, someone that can't stand over a certain period of time to try to help them. Some folks can, some folks can't, and we'll try to accomplish those for those individuals. The game plan, however, is to spend this week making sure that every person that had a canceled appointment last week gets their shot this week. That's not going to be an easy task to deal with. As I said, it will take some patience. If you have a second dose vaccine coming at the Court Street location and you were canceled over the last 5 days, from February 17th up to and including today, February 22nd. There were no vaccines given out today because the vaccines did not come in. You will get an email or a phone call to reschedule your appointment. So look in your email and look on your telephone that you will get a call for a rescheduled date. If you do not receive notification of your rescheduled appointment by today at 3 o'clock, which is just before the end or just after the end of this update, we're giving you a number to call. I assume it'll be on the screen, 995-7425, and we will assist you. You should get, if you had an appointment scheduled from the 17th to the 22nd, you should get an email or a phone call. If you have an appointment scheduled that was canceled and you haven't heard, and you haven't got a phone call back, call 995-7425, and then we'll make those arrangements. The rescheduled appointments will take place at the Community College in Valhalla. Now, we wanted to have people who got the shot at a location get the second shot at the same location. It's a lot easier to remember. However, our physical layout at the community college is larger, and so we can accommodate these two separate streams of people much better than we can at our clinic here in White Plains. So a little flexibility. You know, the delay in the vaccine was uncontrollable, unforeseeable. It happened as the weather has changed on us, and now we're going to try to make up for that over the course of the next few days. If you have any questions, 995-7425 should answer those questions. So the good news in vaccinations are that we have another large center being planned, and I'm going to ask Deputy County Executive Ken Jenkins to fill you in on the details. Ken?
Thanks, George. And as the county executive said, we are all super excited about the much larger vaccination site in Yonkers to add another large vaccination site. Certainly, we want to make sure first to thank Senator Chuck Schumer, Senator Gillibrand, our local congressional representatives, Jamal Bowman, Mondaire Jones, and certainly Sean Patrick Maloney, that were responsible from the federal government in partnering with the state to bring us that additional vaccination location. The location is in Yonkers at the Armory. The Armory exact address is 2 Quincy Place, but for those that know, it's right between Yonkers, Ashburton Avenue on North Broadway, just south of Ashburton Avenue. It is very specific for the first week. So from February 24th, there are a specific set of zip codes in Mount Vernon that will be eligible to make appointments at the website, the MI Eligible COVID website. I'm sure the team's putting it up on the screen again. That is the way to make that appointment. Again, the specific zip codes are 10701, 10703, 10704, and 10705 in Yonkers, and in Mount Vernon, 10550, 10552, and 10553. And those, again, for those specific zip codes, from February 24th, you can start making appointments. Then, on March 3rd, anyone in Westchester County is going to be able to make an appointment starting March 3rd. So once again, February 24th for those specific zip codes, and then March 3rd for everyone else around the county. We are so excited about that site being open. And again, it's targeted to the people in Westchester and targeted for the people in Yonkers. Once again, those 1 week appointments will be able to start, again, February 24th. Please make sure, again, to put in the zip codes. And I know that there may be some people at home and said, I can just put in any one of those zip codes and create an appointment. But just like at all of the sites, the county executives mentioned this many times before, that you will check your ID at those sites and you will not be able to get an appointment, or you will not be given a vaccine to do that. So again, we want to make sure that people take the time, sign up for the opportunities that are available to them. They're supposed to be able to do 1,000 appointments a day. Again, we're getting to the place, as the county executive has mentioned before, that more vaccine is going to be available. And again, the tremendous work between our federal appointments and all the advocacy. County Executive Latimer has always talked about this on these sites today, to be able to open up sites everywhere. And the pop-up sites to be local pop-up sites that are much smaller. But to get the number of vaccines into people's arms that's necessary will require these large sites. So once again, February 24th for those specific zip codes in Yonkers and Mount Vernon, and then March 3rd for everyone else. Thank you so much.
I want to reinforce what Ken just said, which is we recognize that we are not going to be able to vaccinate everybody in Westchester County operating out of the county center and our 2 clinics or through the local pharmacies. We need to have larger vaccination centers, and we need to put up things in all corners of the county. If you live in a corner of the county that isn't close to either the county center or to the new Yonkers site that's going to come in, understand that we are working with the state. As soon as we have sufficient amount of vaccine coming in, we would expect to put in additional locations, larger locations. And if you look at the county as a rectangle, in the middle of the rectangle is White Plains, and so we have a White Plains location. Now we're going to the southwest corner of the county in Yonkers. We would certainly hope that we'd be able to find a way to be in the northwest, the northeast, and the southeast corners of the county as well, to make it as convenient as is possible. And then also, as there are more vaccines available, that the local pharmacies would get more vaccines. So we reach the point where the frequency of getting a vaccination is akin to what you get with a flu shot, which you can get in your doctor's office, you get in your local pharmacy, you can get it at one of our clinics. It's present everywhere. We hope to get to that point as soon as the production levels at the national level are there. We're working with the state, we're working with the federal government, we're communicating with the local governments. We've developed a list of possible sites for additional pop-ups, which the state will make determination on. And we're trying everything we can do within the units that we get as a county government to administer and get it out. But this step forward in Yonkers is a big step. It's the second biggest situation, and we're very excited that that will help us get more folks vaccinated. The standard vaccination information bears repeating every so often, so I'm going to go through what you've heard before. Some of this will be on the screen as we're speaking. We want you to get the vaccine. We want people to get vaccinated. We are not here to prevent people from getting vaccinated, but we are following New York State regulations. If you go on the New York State Department of Health website where they lay out the different phases, everybody in 1A, everybody in 1B is entitled to have a vaccination. There are some selected other categories that might fall in 1C that are eligible, but again, 65 or older, have an of any age, having an underlying health issue, but it's not every possible ache and pain that you might have. There's certain very specific kinds of situations that you would be suffering from which make you eligible for the vaccine regardless of your age. You will find that information on the New York website, and you can access all of this from amieligible.covid19vaccine.health.ny.gov. If you're looking to see what are those underlying comorbidities, they're laid out for you. You'll be able to see on that website, Am I Eligible, exactly what types of illnesses qualify for COVID eligibility for the shot. The state COVID-19 vaccine hotline continues. That's 833-697-4829. People constantly tell me that they can't get through. When they get through, there's no sites to be able to help them. You have to be persistent. There is less product available for a larger demand. So you, the individual, have to take it on yourself to try repeatedly. And what are you looking for? You're looking for the cancellation of an appointment. When that appointment cancels and an opportunity opens up, then you're there at the ready to take advantage of it. And I understand not everybody can do that type of situation. This is the system the state has set up, and so we want to try to be helpful to you. Our program of senior services and a number of local senior centers services in the municipalities have been available to help seniors. If you need help, you want to help your mom or your dad who's a senior age, or you yourself know that you can't handle all this by yourself, call the local village, town, or city hall. Speak to the senior coordinator in your community. You're welcome to call our county offices. If you just want to call in general, 995-2000. You don't even have to look up the specific number. The general number for the county, 995-2000. Ask for senior services, and then you can, tell them where you live and the kind of assistance you feel you need. There is a form that you have to complete before getting the vaccine. You can get that online. It's the same basic place, forms.ny.gov. It's for you right there on the screen. You'll be able to look at it, copy it down. You can keep it up while I'm still talking, and make a note. And if you haven't done it already, that's an avenue for you to fill out those forms in advance. And then there's other information that's available. Same basic platform, COVID-19 vaccine.health. And after a second backslash, it's what you need know. And if there are things and questions you have, you can answer. Look there for answers. You can then call the hotline if you want answers. We're all working as hard as we can to work through this. We have not had a mass vaccination in the United States of America that is analogous to this. This is a much larger country today than it was back in the 1950s when the polio vaccine came out. And the polio vaccine was targeted for a portion of our population, those who were young, of which I was once in that cohort. Now we ultimately have to make vaccines available to everybody. We're starting with a smaller cohort, but it's going to graduate to everybody, and that's going to be important. I want to highlight again what we've talked about before, that on March 3rd, which is coming up next Wednesday, a week from Wednesday, we have a ceremony which will commemorate the one-year anniversary of COVID-19 in Westchester County. It is a somber ceremony. It is not a celebration. And in some of the things that have reported about it in the press, I want to make sure you understand that it begins at 11 o'clock in the county office building lobby here, 148 Martina Avenue, and it begins with an interfaith prayer vigil. That is the beginning of the commemoration. We want to put ourselves in the right frame of mind to remember that we have lost fellow Westchester residents, and that it's a somber interfaith ceremony that begins our activity. There will be a moment of silence at 12 noon. There will be ringing of church bells countywide as a sign of respect, and then there'll be applause for county responders. That starts at 7 o'clock tonight. We're not going to stay 7 hours in the lobby, but we invite people to participate in this from their home area when they can. Flags are going to be flown at half-staff beginning the end of this week, I believe beginning on Sunday. That will be on county-owned buildings and facilities. So you'll see it at county parks. You'll see it at our county office building. We do not control flags in general in this society. That prerogative belongs to the state and the federal government. But we will fly Westchester, United States American flags, and the remainder of the flags at half-staff, and that will go through our commemoration ceremony on March 3rd. We have a winter weather advisory going on right now. I was outside within the last hour. It's snowing. Visibility is a little impacted. The anticipation is 2 to 4 inches. We're pretty expert in the last month about how to handle snow. When you've had 18 to 24 inches, 2 to 4 inches sounds like not much to worry about. But we'll see how it all plays out. I think we're going to be on the low end of that range in Westchester County, and we'll have some rain mix that will reduce the amount of accumulations thereafter. Keep in mind that the snow plows, do not plow until we have 3 inches of snow on the ground. They cannot physically move snow at a smaller amount of accumulation. We may not get to the 3-inch accumulation, so what happens is you get messy streets. You get streets that are covered with a very thin glaze of snow, and obviously if it gets colder tonight, it becomes that much more difficult. But hopefully all of that will be worked through. I have one non-COVID related report to make. This has already reached the newspapers now, and I've commented on my Facebook page. Others have as well. We grieve along with the family of Lawrence Otis Graham, who many of you may know from one of his many involvements within the Westchester County community. He was born here, raised here. He was a lawyer with one of the prominent law firms here in Westchester County. He was a well-recognized author. He had a number of books that became national books of authority and interest, where he spoke of his experience and that of others who were African American. He talked about growing up in an environment where he was well-educated and very talented, but at the same time faced prejudice. These are his words and his story to be shared with. And aside from that, he's a community activist involved in lots of organizations, a lot of boards that he served on. He was the chair of our Westchester County Police Board. And we lost Lawrence on Friday at the tender age of 58. We grieve with him and his children, his wife, Pamela Thomas Graham, who is in her own right a very a very successful executive. Lawrence is a friend for many of us, not just me alone. You would see him on News 12 as a commentator in the Point Counterpoint, which Ken did for many years as well with Mike Edelman. Lawrence was on that as well, and you'd see him every week commenting on different issues that were going on in the society. He left an indelible mark. I met him for the first time when I was campaigning 25 years ago, when I was in the county legislature, knocking on doors where he lived at the time in the south end of White Plains. We chatted at the front door, and I walked away knowing that I had met a very impressive man. And he was all of that and more over his years with us. He has gone too soon. And when I talk about the deaths we have to COVID, it does not identify that was his reason for passing. But it really doesn't matter the reason in terms of losing somebody you care about. So you think about the people you know, you respect, the people you love, and every single one of those people make an impact on you. I lost a couple of other friends in the last week, people I knew very well. Mary Louise Cox from the village of Mamaroneck, who was a terrific poet and active in the Mamaroneck village community. Orrin Beach, who was a volunteer firefighter in the city of Rye. George Hogman Jr. died 2 weeks ago. He headed the boat basin in the city of Rye. All people that I knew personally, would greet warmly when I saw them, sit and have a cup of coffee or drink with them, and they're gone. And when I think of them as individuals, Lawrence and the other people I've just mentioned in this conversation, that's what informs the way I view COVID. And the numbers that we see in COVID, they're not numbers, they're people, they're human beings. And if I didn't know all 2,050 some odd of them, and you didn't know all of them either, it doesn't really matter. You know some of them, or one of them, or some combination of them. And that's why this is so serious. But we wish for his family as much peace as can be found in moments like this. We will miss Lawrence and his contribution to this county. And we hope that, we'll learn from the lessons of his life and be a better county and a better country because of his time with us. With that, we're going to go to some questions. Catherine Chaffee is here. She's got a few. We're going to address some questions that have arisen about the county jail. And as I answer the questions, let me tell you that, and I know this from my time in the public arena, the rumor mill moves fast, and accuracy is not always the companion of the rumor. We've had some rumors that relate to the county jail. They are inaccurate, but as these questions come up, we'll address them honestly and straightforwardly, and we appreciate it if you share the news back for those who may have been telling you other things. Catherine Chaffee, questions.
Sure. So the first one comes from Dave Wolf from News 12 Westchester. It is about COVID at the county jail, and it's a long question, so I'm going to paraphrase. He said they've received calls from loved ones of those in the county jail hearing of sick inmates and inmates who have passed. They're concerned about inmates not getting proper medical care and the facility not being properly cleaned. What can you tell us about the current situation at the jail?
Well, first, let me give you some of the facts that are relevant. As of today, we currently have 5 active cases of COVID with employees within the jail, and we have 9 resident cases. And whenever we have an active case, we deal with the same protocol that we do in the general public, which is isolation. We make sure that they are not in a position to infect anybody else. So this is not 5 workers or 9 residents of the correctional institution that are walking around interacting with other people. They are isolated away through the 10-day period of time now that's required for them to overcome the COVID. Both of those numbers are down from some previous numbers that were slightly above that. We had 9 2 weeks ago, and the number of resident quarantine units, we say resident, other people use the word inmate, we use the word resident. 2 weeks ago was at 9, we'll be down to 4 tomorrow. We have regular ongoing correction officer security inspections in the quarantine units. We have medical and mental health evaluations going on in the jail at all times. Somebody opined that 30 inmates were sick with the virus. 3 have died. Wrong information. Let me say, if I repeat that so you get the emphasis of it, wrong information. No one has died in the Westchester County Jail from COVID. I repeat, no one has died in the county jail from COVID. However that information gets out there, people mistake what they heard about some other place, someplace else, but that is not the case. There are not 30 inmates sick with COVID in the county jail right now. As I've indicated, we have 9 active cases, and those individuals are undergoing isolation. They're being monitored for their health, and none have reached a point at which they need hospitalization, which we would do if an individual's active case became severe enough for hospitalization. As far as proper medical care is concerned, once again, the rumor mill people opine about different things, the cleanliness of the facility. If I could invite you to walk through there, which I can't because it's a secure facility, it's not the place we do general tourism. But our medical provider, WellPath, is in close contact with our leadership there, and they are detecting, treating any kind of suspected cases. They're keeping proper cleanliness in the facility, and we believe that that the people who hear these things, hear it through the grapevine, and repeat it in error, perhaps one person who had been there at some point or heard from a friend, and they repeat this as fact. It is not fact. We're doing everything we can at the jail to make sure that we have the right protocols in place, and we stand by that information. If there's any further pursuit by members of the press, we'll be happy to talk about that offline as necessary.
Okay. The next question comes from Jean, also from News 12. She asks, how many doctors, nurses, medical personnel are staffed at the county center and at the county-run vaccination sites?
Well, Gene, we can get you exact numbers offline. I don't have those numbers right at the top of my head. We have a sufficient number of doctors and nurses to be able to deal with both those who are vaccinating. We often have nurses do the vaccinations. We have sufficient doctors supervising, particularly after the vaccinations have been given. There's a 15-minute period of time where after you've been vaccinated, you have to wait and you're under observation to make sure that you don't go through any kind of shock that might occur after the vaccination. We have had no incidents of any individuals becoming seriously sick after the vaccinations, no emergency rushes to the hospital and anything of that nature. But we can get you exact numbers of doctors and nurses if that's an important statistic for you to have. We'll be happy to share that information. But I've been to the center a number of times to sort of walk through and look at circumstances. I've been at the clinic any number of times, and we're not overloaded. There's none of this. There's too many people and we don't know how to handle all of them scenario. Even in situations where we have people coming early for appointments, that creates some outside lines. The operation internal has been very good, and we've heard nothing but compliments. Almost every single person that has been through the system, either the county center or through the county clinic, has commented how well run it is. So we're confident that we're doing the right thing.
Okay. The next question also comes from Jean from News 12 Westchester, and this is the last question. Is there a wait list for people for the extras at the end of the day, and can people wait outside to see if extras are available?
This has to be one of the great urban myth tales that at the end of the day, and I hear this from pharmacies, I saw this at the pop-up centers when I visited there, people are anticipating that there's going to be some leftover at the end of the day, and that's how they can sneak in and get a shot. What every operation does, we do this at our 2 locations, it happens at the county center, and it happens, by the way, at the local pharmacies and the pop-up centers. By middle to 2/3, 3/4 of the way through the day, there's an estimation of how many people may have fallen off of appointments. And so we know what there may be of a gap, and immediately some element of the staff reaches out to people who were the next people in the queue eligible for the shot, and they're given a call and they're said, we're going to have an available shot at the end of the day. If you can make it over here, you can get your shot. But you're already eligible. You were already on the list. Let's say there was 200 people at the pop-up center. This is the 201st person, the 202nd person who signed up and was not able to get into the first 200. There is no show up and get a shot scenario. And by the way, I understand, completely, how people are concerned. They find it difficult to get their appointments. I was scheduled for an appointment that I lost last week because the vaccine didn't come in. And, and I'm waiting now what amounts to another week before determining when I can get my shot. I have been age eligible, for quite a while. But I know many other people who have comorbidities deserve the shot more than me, so I'm more than happy to try to satisfy as much of that cohort as possible. But there's no sort of hanging around the stage door to see if you can catch a glimpse of the star. All of the shots are identified, and there's an effort made to try to make sure that other people who had signed up for the shots are the ones that get it. It's an important concept to understand. There is no showing up to get a shot without an appointment. Let me repeat it. There is no showing up without an appointment to get a shot. That It does not exist. You will not, and no one wants to be rude to you. We want you to understand before you set sail from wherever home is, heading to one of these locations, figuring that you might be able to sneak up one. No. If you don't have an appointment, do not go. You will be denied. If you lie on your application, not that anybody would, but if you lie on your application and you assert that you're a certain age when you're not, someone's going to look at your driver's license and it's going to be determined you did not reach the chosen age of 65 yet. Trust me, when you hit 65, as I have and passed it, you're not happy to show that. But the bottom line is this is one of the handful of times when it actually has an advantage to you. If you lie about your age, if you lie about your comorbidity, you will be sitting in the screening location and you will be rejected from getting your shot. So you would do well to not even try to lie your way in and come up with a game plan that you think is going to work. As soon as there is sufficient quantity for everybody, we want you to have a shot. We want everybody to have a shot, but we don't have sufficient shots now. And I promised Ken I was not going to talk about cookies anymore. We're done with that analogy. But the bottom line is we do not have sufficient supply. We understand how much people want it. And not just people who are eligible, who can't get an appointment, but people who are not yet eligible based on the rules of the state of New York. But our task, our job as a county government, we don't make the rules. We don't set the system. We don't program the computer. We don't ask you the questions. Our job is to implement that which is state policy as has been established through the governor's executive authority. And that's our job. And we're doing it as well as we can. We've already got 70,000 some odd people vaccinated through our activities. And the total number of people vaccinated is much more significant than that. We passed the 100,000 mark when you add in the impact of the pop-ups and all of the different pharmacies and the hospitals that vaccinated workers in their staff. So we're doing the best we can. But I'm sorry to say, Gene, there is no showing up to get a shot. Go through the procedures that are necessary, and we'll do our very best to make sure everybody gets a shot. Trust me, no one wants these things open more than we do, because if everybody gets vaccine, then the society has a shot at coming back to normal. We can start to reopen things. People will feel more comfortable going out and interacting. Some of the community activities and events, we're right now discussing the future Playland. Governor gave us a green light to be able to open amusement parks. We would very much like to open Playland, but we're thinking about how do you run an amusement park with social distancing? How do you run an amusement park with multiple rides with constant sanitation of those rides? We're trying to work through how we would do it. And trust me, if by the time we open the doors of Playland, we knew that almost everybody had had the vaccine, we'd feel a lot better about opening the doors to Playland. So that's the game plan. Hopefully we can resolve it. But thank you, Gene, from News 12, for your questions. There are no other questions, but if anybody from the press has any questions for Catherine, please feel free to reach out to her at 995-2932, and she'll be happy to try to help you. We'll be back on Thursday at 2 o'clock. We're going to introduce to you, I believe on Thursday, our new commissioner for the Department of Social Services. We'll let it be a little bit of a surprise until you have a chance to meet that individual, and we'll give you the update of where we are. Hopefully the numbers will continue to drop, and we'll continue to be able to be moving in the right direction. I'm George Latimer, Westchester County Executive. Thank you for watching. Look forward to speaking to you and seeing you on Thursday. Be safe.